Well, hello, ladies and gentlemen. It's my pleasure to be with you in this nice program which discusses the health issues in the holy month of Ramadan, a month that comes every year, and all the family waits this month because it has a special celebrations, it has a special emotional feelings, and the whole mark in this month that everybody of the family is fasting. Nobody eats until the sun sets. So it has a special circumstances, and I think that the pregnancy, if pregnancy occurs during Ramadan, many questions arise in the mind of the pregnant ladies about should I fast or not, and in particular if she has a health problem during pregnancy, does this affect her status, and what are the recommendations as regard pregnancy in this particular status. Well, pregnancy by itself is a physiological process, and physiological means it's something absolutely normal. It happens to all ladies, and it goes well most of the time, and it ends in a very happy event, and it occurs from the beginning of creation of mankind up till now. But this does not mean that we don't have complications or problems sometimes during pregnancy. In a fraction of pregnant ladies, sometimes they suffer what we call, it's a common name, toxemia of pregnancy, but I don't want you to understand that there is any toxins in this. It's called toxemia, but it has nothing to do with toxins in particular. But this term refers to pregnant ladies who suffer rise in the blood pressure, edema in the body, which means swelling all over the body. Swelling of the body is common during pregnancy, and I don't want you to be terrified or frightened by having swelling arms or swelling of the legs. But if this coincides with rise in the blood pressure, here the bell rings that there is something going wrong in this pregnancy. Plus these two issues, also the occurrence of proteins or albumin in the urine, we call it proteinuria or albumin in the urine. So this completes the triad of the diagnosis of toxemia of pregnancy. Or sometimes we call it pregnancy-induced hypertension. Hypertension is a medical disorder, but when it occurs with pregnancy or predisposed with pregnancy, this is the toxemia that we are talking about. Well, to let you know also, it's another very common event in pregnancy. It happens in about 5 to 10% of pregnant ladies. This means that out of 10 pregnant ladies, we meet one of them who have this problem of hypertension with pregnancy. It's not necessarily a frightening situation so long that the pregnant lady is doing her antenatal care. She visits the doctor on a regular interval. Doctors are aware about these problems. We look for it, we search for it. What we do in antenatal care is that we measure the blood pressure, we put the lady on the scale to check her weight, and we examine the limbs. If we find any of the warning symptoms about the toxemia or the rise of hypertension, we immediately behave with the case on a proper way. We put her in a special regime of food and certain medications to control the situation and to carry on pregnancy safely till the end of the term. The problems or the catastrophe happens when we neglect these cases. Either she is not visiting her doctor, she is not doing her antenatal care on the regular basis, she vanishes for about a month or two and then come back to the clinic with the full-blown picture of swelling of the whole body, with the edema all around, and the hypertension, severe headache. This is the terrible situation that we don't like to meet and we never like to see in our patients. First, how the lady suspect that she is going into this process. We teach our patients that there are some warning symptoms and signs you have to take care of, like progressive weight gain above the standard, above the normal. All pregnant ladies, they gain weight, we know this, but if the gain of weight is more than 2 kilograms per week, this is something suspicious. This means there is accumulation of water in the body more than the needed. Or abnormally excessive headache. Also, I don't want you to be terrified because all pregnant ladies, they suffer headache. Headache is very common, but when it is day and night, all the time, and severe to the extent that causes drowsiness or blurring of vision, this is the headache that I'm talking about, or this is the pathological status. So headache, swelling in the limbs, severe gastric upsets, excessive vomiting, or she's complaining that she's not feeling well, the fetal movement, or the baby is not growing well. All these things points and put doubts about possibility of developing the hypertension with pregnancy, or the preeclampsia or toxemia of pregnancy. All these are interchangeable terms about such disorder. So what we do for those cases that we like to control the blood pressure to avoid the excessive weight gain. So there are some advices, some recommendations we give, and some medication that we have to follow. The advice is that we like this lady to live a very quiet and sedentary life. We ask her to take absolute rest from her work. If she's doing a job, she has to take a sick leave or a vacation, and rest from the household activities. I know it's a common thing that ladies or women, they are responsible about everything in house, raising the children, taking care of cooking the food, the house cleaning, and taking care of her husband. So there are a lot of duties about her. So I asked the family to be considering to give her a chance to rest. I don't mean rest that she has to sleep in bed, but her movement will be restricted from the bedroom to the balcony to the television. This is what I mean by rest. She can visit her relatives, but not to take responsibilities about doing effort or anything like this. So this is number one. And when we mean rest, we mean physical and mental rest. Mental rest is more important. She doesn't have to worry about something. So the whole family should have to support her, to give her a hand of help, and to be appreciating and considering. Don't ask her too much to do for you. Next to rest, physical and mental rest, we'd like her to avoid certain types of food. Spicy food, excessive salt. We put some restrictions on salt on food because we know that salts contain sodium and sodium chloride. This retains more water in the body, and this raises the blood pressure more and more. So avoid totally any salts and any salty foods, or like pickles and such things. And we like to give her excessive of proteins because, as I mentioned, there is lots of protein in urine, what we call proteinuria, so we have to replace this. And a very, very funny thinking in many ladies, I hear this a lot. She says, I have protein in urine, so I have not to eat eggs and meat. This is actually not smart thinking. When you lose proteins, you have to eat more. So it's a simple thinking when you say not to eat protein because I have a proteinuria. So I recommend and advise to have a plentiful of proteins in the form of meat and eggs and so on, so on, so. So this is as regards the rest and the diet. Medication, this is the job of a doctor. We have a big list of antihypertensive, which is drugs which lowers the blood pressure, starting from easy tablets up to injection in severe cases. Sometimes we see cases in severe hypertension, and this is an emergency. She has to be admitted in hospital. We give sedations and we give injections to lower the blood pressure. But this is rarely to be needed if the lady is controlling her blood pressure with tablet form. It's very common. I don't want to mention names in the television. You're not allowed to go to the pharmacy and tell, give me this medication. Your doctor should prescribe it for you, and it's given in an escalating dose until we control the blood pressure. Some women are very apprehensive. They have anxiety about their condition. We'd like to add some sedatives, anxiolytics drugs which decrease or reduce anxiety to let them sleep well. When they sleep well, they wake up in a good mood, and this actually helps to control the blood pressure. If they don't sleep, they're very anxious, they think a lot, their mind is working on all the time, so this will aggravate the hypertension. So from what I said, it's very obvious that we cannot allow her to go fasting in Ramadan. She is receiving medication on a very regular and fixed schedule. We cannot shift this schedule. Some woman says, okay, can I take this medication on the sunset on fasting and with the suhoor? No. She has to take it in the morning. She has to sleep well, okay? And she has a guest living inside her, the baby. So she cannot actually neglect giving him his nutrition and his requirements, and to neglect taking the medication, which will lead to rise in the blood pressure, and this will affect the baby. So be confident. Never feel guilty when you abandon fasting in Ramadan, and I am sure that she will be blessed by the merciful God, and she will be blessed by all the family. And my advice is not only to the pregnant lady. Pregnancy itself is something needs support and endorsement and appreciation from the whole family. So enjoy this holy month, and I wish you best of luck. Thank you very much.